recorded. If you're experiencing technical difficulty, please use the chat for assistance or the help options within Zoom. We'll do our best to make sure that accommodations are being made. All lines have been muted. And given the volume of virtual meetings we're all experiencing and that our staff is all working remotely in separate locations, I just wanted to apologize in advance for any network connectivity issues, and we'll do our best to solve problems as they occur, and we appreciate your flexibility in advance. I'd first like to introduce myself as well. I'm Sarah Kirch, and I'm the director of the Wisconsin Cancer Collaborative. We appreciate you all taking the time out of your day, and especially in these uncertain times, to participate on today's webinar. We're delighted to have so many new people join us today, along with existing members. Before we get started today, given that the Wisconsin Cancer Collaborative is relatively new to some of you, I thought we'd spend just 1 minute providing a brief overview of who we are. We are the Wisconsin Cancer Collaborative, Wisconsin's statewide comprehensive cancer control coalition comprised of 140 organizations working together to reduce the burden of cancer for everyone in Wisconsin. Organizations are diverse and represent multiple different perspectives. Nonprofit organizations, community-based organizations, health systems, cancer centers, local public health departments, academic medical centers, and many more. We connect our members with tools, support, and knowledge they need to create healthier communities. Our work is guided by the Wisconsin Cancer Plan, which acts as a blueprint for action. The Wisconsin Cancer Plan combines best practice, reliable data, and concrete action steps for health system leaders, public health advocates, policymakers, researchers, and all other Wisconsinites engaged in cancer work. If you're not yet a member of the Wisconsin Cancer Collaborative, we welcome you to join. We would love to have your participation. Membership is free. You can visit www.wicancer.org for more information. Let's go over the agenda for today's call. Today's webinar will provide resources and information about COVID-19 and cancer, but also an opportunity of those joining the webinar to share how your organizations have been impacted and how they continue to address the needs of cancer patients during the pandemic. You'll first hear from the Department of Health Services on the current state of COVID-19 in Wisconsin. We'll then discuss what we know about COVID-19 as it pertains to cancer. Reliable information and resources is more important than ever. Find out on today's webinar where to go for credible information. We hope to have the majority of our time remain to then turn to our participants. We want to hear how people around the state of Wisconsin are addressing cancer patients during the pandemic. At the end, we'll take time to answer any questions you might have. We are experts in our own right and may very well have the answers to other participants' questions. That's really, in essence, what the Wisconsin Cancer Collaborative is all about. But we are also delighted to share we have 2 additional experts on the call today to answer your questions. Dr. Mark Wagner with the Wisconsin Department of Health Services and Dr. Noel LeConte, a medical oncologist with the UW-Carbone Cancer Center. If a question cannot be answered today, we'll do our best to solicit the right expertise and follow up with answers. We do have staff monitoring the chat, and we'll do our best to answer questions and address comments. But if we do miss something, we'll provide a recap and a follow-up email we intend to send out after today's call. So I would now like to introduce Dr. Mark Wagner. Dr. Wagner serves as the Chronic Disease Medical Advisor within the Wisconsin Division of Public Health at the Wisconsin Department of Health Services. In addition to answering questions you may have about COVID-19 and chronic disease, including cancer, Dr. Wagner will provide us with a brief update on Wisconsin's COVID-19 numbers as of Wednesday, April 8th, just yesterday.
Thank you, Sarah. These are certainly challenging and unprecedented times for Wisconsin and the Department of Health Services. As you all are aware, information changes rapidly, and it really takes everyone working together to help keep everything under control. And I just wanted to thank all of you for everything you're doing every day to help mitigate the impact of this disease. I'd also like to provide a quick update on where things stand with COVID-19 numbers in Wisconsin. So the Department of Health Services provides daily updates on the number of COVID-19 cases in the state, and that data is updated as of 2 p.m. every day. So after that time, we kind of lock things in just because of the way things are changing. it's the best way to just sort of keep a good snapshot of what's the current situation. You can take a look at that data at the link that's found on that slide there, www.dhs.wisconsin.gov/COVID-19 and also you can just visit the main website at dhs.wisconsin.gov and you can be directed to the information from there. And as you can see from the slide, as of April 8th, so as of yesterday at 2 p.m., we had 30,115 negative test results, 2,756 positive test results, 790 hospitalizations, and 99 deaths. That in the map, as you can see, which was also taken from the DHS website, where we have a number of great sources of data, shows that as of April 7th, as of April 8th, 60 of the Wisconsin's 72 counties have had positive cases. But again, if there's a situation where there is not a case, I think that you still need to consider that there is somewhat spread in the community just because of the fact that this can be asymptomatic and that it takes a significant amount of time in many cases for disease to be discovered. So just the fact that there is not a case in a particular county does not mean that that county does not need to worry about or does not need to take precautions at this time. One thing that we're trying to get a better picture of is how many of these patients have underlying health issues such as cancer. And we're working with partners to try to get this information, but we do not have a good grasp of this at this time. But we'll do our best to report that information once that is available. In my role as the Chronic Disease Medical Advisor at the Division of Public Health, I'm going to continue to work with our chronic disease programs, including the Wisconsin Cancer Collaborative, to continue to address ongoing concerns and needs for everyone in Wisconsin with chronic conditions and cancer. And I believe we have one more slide. Another thing that this has unfortunately shown, it has kind of shown some of the underlying inequities we have in our state. And as you can see, when we look at the percent of COVID-19 cases by race and the amount of deaths by race, we see a very disproportionate impact on the African American community. And again, there are a number of factors for this, but one thing, it just really highlights the inequities that we have in our state. And so we'll definitely have to be looking at this as we are moving forward. So yeah, and you can see the percent of cases by ethnicity and also the deaths by ethnicity below. But I think the major take home that we're seeing, and this is what people are seeing nationally if they are tracking this data as well, is a huge impact in the African American communities. So that's the current state of where things are. I can say also that we've seen, in general, we've seen some success in flattening the curve a bit based on the Safer at Home directive and social distancing, but we are certainly not out of the woods at this point. We continue to have increases in cases daily, although we have seen that the percent increase from day to day has decreased. And we are also seeing that the doubling time has decreased as well. So we're seeing some good signs there, but it's all the more reinforcing that we need to continue implementing these safer at home order and the social distancing measures. I'll be on the line also we'll continue to stay on the line at the end of the call if there are any questions regarding some of this information. Thank you.
Thank you, Dr. Wagner. I did see a few questions pop up in the chat box, and for the sake of moving through just some brief content and then saving the second half of today's webinar for question and answer, we'll make sure that the team on monitoring the chat takes track of the questions being asked right now. And again, Dr. Wagner will stay on the line after the presentation ends to answer those questions. So I will now turn the presentation to Alex Peters, an outreach specialist with the Wisconsin Cancer Collaborative. Information and resources are changing rapidly as we increase our understanding of this pandemic. Alex has been monitoring the pandemic on our team and will provide a brief overview of what we know now.
Thanks, Sarah. Good morning, everybody. My name is Alex Peters, and I am an outreach specialist with the Wisconsin Cancer Collaborative. Thank you again for joining us today, and also thank you to all of the healthcare workers who are doing so much right now. Before I dive in today, I want to preface this with letting everybody know that I myself am not an oncologist, nor a COVID expert necessarily, but what we did today was pull all of the available relevant information to share out to you, and we will do our best to answer all of your questions. By this point, I am sure many of us are aware of the basics on COVID-19. However, before moving on into greater detail, I want to lay the groundwork and start from the beginning, starting with what exactly COVID-19 is. COVID-19 is a disease caused by a novel virus that can cause mild to severe lung infections in people. It can cause more severe disease for individuals with weakened immune systems, like cancer patients, for example. The virus may also cause more severe infections than we typically see with other viruses. So how does COVID-19 spread? Again, this is a new virus, so this is what we know at the moment. The virus is thought to spread mainly from person to person between people who are in close contact with one another within about 6 feet through respiratory droplets produced when an infected person coughs or sneezes. These droplets can then land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. People are thought to be most contagious when they are most symptomatic, but we do now know from recent studies that a significant portion of individuals with coronavirus may lack symptoms. And even those who eventually develop symptoms can transmit the virus to others before showing symptoms. In light of this new evidence, I just wanted to highlight the changing CDC recommendations around wearing face masks. So the CDC now recommends wearing cloth face coverings in public settings where social distancing measures are difficult to maintain, like in grocery stores or pharmacies, for example. So the cloth face coverings recommended are not those surgical masks or N95 masks. Those are critical supplies that we must continue to reserve for healthcare workers. So another mode of transmission is spread from contact with contaminated surfaces or objects. So it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main spread of transmission. So what are the symptoms of COVID-19? Symptoms of COVID-19 include fever, cough, shortness of breath, even though we have seen a wide variety of other symptoms in people as well. Emergency symptoms include persistent chest pain or pressure, new confusion or inability to arouse, or bluish lips or face. These are all symptoms that somebody should seek immediate medical attention. It is also important for cancer patients to monitor for all of these symptoms and call their doctors if any appear. So who's at greatest risk for severe illness? While many and most of us are not at risk for severe illness, we do know that there are several populations who are at a much greater risk, including older adults, those 65 years and older, people who have serious underlying medical conditions like heart disease, diabetes, and lung disease, people who are immunocompromised, including cancer patients in treatment, and also people who smoke or vape are also thought to be at a greater risk. Vaping and or smoking harms lung health, and we know that when cells of the lung are impaired, it diminishes the ability for them to respond to infection, which is why they are thought to be at a higher risk. Additionally, smokers are putting their hands to their face more often, which may also increase their risk. Let's look a little bit more closely at risk for cancer patients in treatment. While data is still pretty limited, there is preliminary evidence that indicates cancer patients are at a much higher risk for severe illness than the general population. An early report out of China indicates cancer patients compared to patients without cancer with COVID-19 are at a 3.5 times higher risk of mechanical ventilation, ICU admission, or death. A recent preprint study, meaning that it has not yet been peer-reviewed, that was actually released this morning, found that patients with blood cancer, lung cancer, and metastatic cancer demonstrated a higher incidence of severe events, meaning mechanical ventilation, ICU admission, or death, compared to patients without cancer. In addition, patients who underwent immunotherapy or cancer surgery also had higher death rates and higher chances of having critical symptoms. So what should cancer patients do to protect themselves? Doctors and health officials agree that the best way to prevent this illness is to avoid being exposed to the virus in the first place, which is especially important for cancer patients. While there isn't currently a vaccine or cure for coronavirus, there is a lot that can be done to protect your health. And we know that the best remedy for COVID-19 is prevention, and that social distancing is key. So what are some steps that cancer patients and survivors should do to protect themselves? In addition to social distancing, the CDC also recommends the following, including avoiding close contact with others, keeping hands clean, making sure your healthcare team is also taking steps to protect you from exposures, cleaning and disinfecting frequently touched surfaces, and avoiding non-essential travel. There is no current specific guidance on mask use in cancer patients. However, the CDC does recommend using a mask if you are sick. And like I mentioned earlier, the CDC now does recommend the use of simple face cloth coverings to slow the spread of the virus and help people who may have the virus and do not know it from transmitting it to others. So what should cancer patients and survivors do to prepare for COVID-19? In addition to those preventative steps I mentioned, it is still important to plan ahead and prepare. The CDC recommends the following, which includes taking actions to reduce your risk of getting sick, meaning maybe stocking up on some extra supplies, avoiding crowds, and staying home as much as possible. They also recommend having extra supplies on hand, such as obtaining extra medications from their doctor, having extra medical supplies, household items, and groceries, and also considering other ways of getting food brought to their homes, either through family, social, or commercial networks. Taking everyday precautions is also important, washing hands, avoiding touching your face, and cleaning and disinfecting the home. And then lastly, having a plan for in case you do get sick. That means consulting with your healthcare provider for more information about COVID-19 and your risk, determining who can care for you if your caregiver does get sick, and in the case that you do get sick, making sure you have a healthcare power of attorney completed and that your healthcare system has a copy, or you bring it with you to the hospital. It is also very important for people who live with or take care of people with cancer to take steps to keep themselves healthy. Therefore, in order to minimize their risk of being infected, they should follow the following precautions recommended for the cancer patient as much as possible. This includes watching out for symptoms of infection, that is having a fever of 100.4 degrees or higher, cough or shortness of breath, cleaning their hands often, avoiding people as much as possible, or practicing social distancing. And if they must leave home, avoid places where people congregate, and having some extra supplies and food delivered to their homes as well. In the case that a caregiver does become ill, they should immediately separate themselves from the cancer patient, and if possible, staying away from the patient's home. If they must remain in the same household, they should isolate in a separate room, and if possible, with a separate bathroom. They should also make arrangements for somebody else to care for the cancer patient. So we've talked about what cancer patients, survivors, and their caregivers should do. Now let's take a look at what many cancer centers are doing in response to COVID-19. Many major cancer centers have implemented the following policies to help protect patients and staff, including screening all patients, staff, and providers for COVID-19 symptoms and travel history, minimizing follow-up visits and admissions, training staff in using personal protective equipment, engaging in telehealth and WebEx meetings, providing a COVID-19 hotline and response teams, and also placing restrictions on employee business travel. In addition to the above measures, the American Society of Clinical Oncology further recommends home collection of routine lab samples and home infusion of chemotherapy drugs whenever possible. Also, one study out of Wuhan concluded that aggressive measures should be undertaken to reduce frequency of hospital visits of patients with cancer during a viral epidemic going forward. For patients who do require treatment, proper isolation protocols must be in place to mitigate the risk of COVID-19 infection. So what are some special considerations for patients in cancer treatment right now? Some things to keep in mind or consider are patients should discuss with their doctor the benefits and risks of continuing, reducing, or delaying treatment, and also discuss their goals of care and tailor therapy based on those. What we do know is that it's important to reduce the frequency of in-person visits as much as possible. So some things that patients can do or inquire about include inquiring about the ability to be on an oral chemotherapy regimen if possible, inquiring about home lab monitoring, and even inquiring about reducing the frequency of ports being flushed. So in addition, we wanted to quickly think through some of the implications we may see across the cancer care continuum, both now and down the road. This is not exhaustive by any means, but we should anticipate that COVID-19 will have a significant impact on the cancer care continuum. For those who aren't familiar, briefly, the cancer care continuum is a figure used to describe the various stages of cancer, from etiology, prevention, early detection, diagnosis, treatment, survivorship, and end of life. So starting at risk assessment, we can expect that in-person visits to assess one's cancer risk are being rescheduled, delayed, or even canceled. We don't know if down the road, perhaps this will translate into missed opportunities for prevention, but perhaps telemedicine is something that could help mitigate that. Moving on to prevention. As people shelter in place, people may be less likely to engage in risk reduction behaviors, such as healthy eating, exercise, not smoking, and drinking minimal alcohol. We also may anticipate delays of individuals receiving vaccines like HPV, which can help prevent some forms of cancer. Moving on to screening and early diagnosis, we know that there will be delayed or postponed screenings. The American Society of Clinical Oncology currently recommends, in order to conserve health system resources and reduce patient contact with healthcare facilities, that cancer screening procedures that require visits such as screening mammograms and colonoscopies be postponed for the time being. That being said, we may see later stage diagnoses down the road, which is something we have to keep in mind and consider. Moving on to treatment. We know that treatment may be delayed or reduced to prevent in-person visits to healthcare facilities. Like I mentioned earlier, the evidence suggests that aggressive measures should be taken to reduce the frequency of patients' visits to healthcare sites to help prevent infection. So home collection of lab samples and home infusion of chemotherapy drugs whenever possible is something that will be important to do. Other implications of COVID-19 to think through is that as resources become more limited, cancer patients may be less likely to qualify for those, like ventilators, for example. Also, COVID-19 is impacting the cancer care workforce. Many are being redeployed or reassigned, and sometimes even laid off if they are strictly surgical. Now looking at survivorship, we know that there will be delays in follow-up survivorship care, which may impact health. Also, like I mentioned in the prevention box, survivors may be less likely to engage in those important risk reduction behaviors like healthy eating, exercise, not smoking, and minimal alcohol consumption as they shelter in place. And lastly, looking at end-of-life care, some implications we may see here are as infection control measures come into place, this may prevent family members from being present at end-of-life situations. Also, as in-person visits become restricted or rescheduled to be held over telemedicine, it can be very difficult to hold those end-of-life conversations over telemedicine rather than in person. And so with that, I want to wrap up my portion of the presentation and hand it over to our policy coordinator, Amy Johnson, who will provide a brief update of COVID-19 policies, both in the state and the country.
Thank you, Alex. As you know, COVID-19 has generated a lot of activity by all levels of government. And I'm going to focus this next portion of the webinar on the actions of our governments that may impact cancer care and persons living with cancer. Looking at the state level, Wisconsin's response to the virus has been one of the more aggressive among states. You probably know about the public health emergency declaration on March 12th and shutting down of K-12 schools and the Safer at Home order that took effect on March 25th. Then at the end of March, the month of March, the state's insurance commissioner asked Wisconsin insurers to give small employers the ability to keep furloughed employees or employees who had their hours reduced below 30 hours a week to remain on their employer's health plan. This move is intended to address the fact that many health insurance contracts with small employers only insure workers who put in 30 or more hours a week. The legislative picture on the state level is complicated, to say the least. Lawmakers and the governor are in negotiations about what needs to be done to direct the funding coming from the federal government, which I'll talk about in a minute. One of those challenges is resolving a hang-up concerning the increase in federal funding for the Medicaid program from the federal Phase 2 legislation. That's a question of about $150 million that needs to be answered. Turning to the actions of the federal government, the response by the feds has been quite simply unprecedented. Before I explain the three legislative phases, it's important to note two actions by the Trump administration, specifically regarding the Affordable Care Act. As you may know, plans provided under the ACA ensured that insurance covered what is known as essential health benefits and set a floor for acceptable standards. Thanks to the ACA, the Centers for Medicare and Medicaid Services quickly communicated to insurers that COVID-19 diagnosis and treatments are essential health benefits and therefore must be covered. Second, a number of states have opened up their state-run health insurance marketplaces to allow uninsured persons to obtain coverage. Wisconsin's marketplace is administered by the feds, however, and the Trump administration decided around the very end of March that it would not open up the marketplace during this time for those seeking health insurance. This does not affect the fact that recent unemployment remains a qualifying event to enroll in coverage. Okay, turning now to activity by Congress, there were three bills, or phases as they were called, that were adopted by Congress and signed into law by the President during the month of March. It's important to note that these bills are not intended to be economic stimulus acts, but rather prevent conditions last seen during the Great Depression, not recession, the Great Depression. Starting with the $8.3 billion Phase 1 bill, this phase directs almost $6.5 billion for Health and Human Services, including $2.2 billion for CDC to address state and local preparedness. Included in the funding for the Health and Human Services is an earmark for $100 million to community health centers. Of that, about $1.1 million will be delivered to Wisconsin community health centers. It also directs more than $300 million to ensure that Americans will be able to get the vaccine when approved, regardless of their ability to pay. Thanks to this bill, the state of Wisconsin received about $10 million to support what was termed response and prevention efforts. Finally, the bill provides about $500 million to Medicare providers to extend telemedicine services to beneficiaries, which is very important to cancer patients. Congress then moved on to Phase 2, which was estimated to cost around $100 billion. Phase 2 covered free testing, emergency room visits, and doctor's fees associated with testing for the virus. It also provides sick leave to those impacted by quarantine orders. Finally, Phase 2 provided a boost in funding for state Medicaid programs. As you can imagine, state Medicaid programs now are going to be strained to fund a sharp increase in medical care provided and the potential of a flood of new beneficiaries who lost their job. One estimate I read this week put the number at 35 million Americans who could lose their employer-sponsored health insurance as a result of the virus. Then the $2.2 trillion Phase 3 bill was passed at the very end of March. It included with it the $1,200 payments that most of you have heard about. The bill directed more than $150 billion for the healthcare system. Of that, $100 billion will be sent to hospitals. Furthermore, hospitals that treat Medicare patients for COVID-19 will receive a 20% increase for all services provided. In addition, the $150 billion will be given to state and local governments to address spending shortages related to the virus. According to the Legislative Fiscal Bureau for the Wisconsin State Legislature, the state is expected to receive approximately $1.9 billion. Again, this funding can't be used to fill existing budget gaps for the governments, but it must be targeted for COVID-19 relief. Finally, the bill includes several provisions intended to provide assistance to nonprofit organizations. As for the hospital funding, the virus has hit the hospitals very hard, both in caring for COVID-19 patients, but also in the lack of revenue that would come from non-essential surgeries and other procedures that have been postponed. How much of the $100 billion provided in phase 3 will come to Wisconsin? Not to mention, how will the funds that come to Wisconsin be directed? That has not been made public, and we just don't know at this time. Going forward, we'll be watching closely the any further steps by Governor Evers that he may take administratively, and efforts together with the legislature for those enrolled in Medicaid and other insurance options. We're also going to be watching for the next phase or two that's expected from the federal government. The size and scope of that next round of relief is being negotiated as we speak. Okay, I'll turn it back to Alex now.
Thank you, Amy. Before we turn it over to questions from participants, we'd first like to ask you all a few questions. Given the call volume, please use the chat feature to respond. Beth Brenner, the new partnership manager with the Wisconsin Cancer Collaborative and longtime member, will help track your responses and facilitate the conversation. Thank you, Beth.
Yeah, thank you, Alex. So what we're asking is, how are you as our Wisconsin Cancer Collaborative members handling the COVID-19? So just some prompts here of individuals, if you feel comfortable sharing with us in the chat, is how are you handling the COVID-19? We'd also love to know what resources are missing that we could possibly help develop or help search for. And then the third one is, when the pandemic subsides, what support do you all anticipate needing as we kind of work through with community members on reducing the cancer risk, getting community members screened, reducing anxiety about contracting COVID-19 when we start to return back to normal, and when in-person cancer treatments appointments start again. So if you have some thoughts that you'd like to share as community members and as our collaborative members, we'd love to hear that in the chat. So we have Jennifer Balistreri with Aurora Healthcare is sharing that they have started using Advocate Aurora Health app for virtual appointments and reports being shared with patients in MyChart. So they're hoping to have more patients sign up for this option. Thank you, Jennifer. We also have Sophia sharing that their team works with survivors, and there isn't much info about COVID-19 and cancer survivors, but they're hoping to get a lot of questions, but we're getting a lot of questions, and sorry, my chat is jumping, but there's much more information about COVID-19 and cancer, and they're hoping that there's getting a lot of questions, but not COVID and survivors. So looking for some more information, Sophia, about COVID-19 and survivors, not just those that are in active treatment. So Sarah Solly with the American Cancer Society Cancer Action Network in Wisconsin wanted to share a bit. So I know she has a resource in here too that she's going to share, so make sure you check it out in the link. But just sharing what the American Cancer Society Cancer Action Network is doing now. Knowing that these difficulties are continuing, and there's a theme that has emerged that cancer hasn't stopped. So thank you, Sarah, for sharing that, because that is so true. Cancer has not stopped. And so neither has the American Cancer Society Cancer Action Network. So I love this, that Sarah is sharing all the wonderful things that their patient advocacy and the ACS Cancer Action Network are doing as priority issues, which is the most critically the need for access to adequate and affordable health care. And they're doing this both at the local level and in Washington, D.C. So Sarah, thank you so much. I appreciate you sharing that. And I know you're a wonderful resource if people need additional information. Gloria Singleton Young is at Komen, is planning a series of webinars on different topics related to breast cancer and COVID-19. We have another one, Area Jordan. So what can cancer survivors, I'm going to grab that and I'll probably share that in our questions. These are really good. Okay. Thank you, Deborah. We have Deborah Nevels from the Medical College of Wisconsin Community Engagement Team They have developed a resource tool for after the pandemic slows. So that is wonderful. I bet Deborah would be willing to share if anybody was interested. Linnea with Gilda's Club of Madison has shifted all of their free emotional support to Zoom, so people affected by cancer and those who care for them can join Gilda's virtually. So currently they are still offering support groups, individual counseling, patient advocacy, yoga, guided relaxation, and all programs are at no cost to those who participate. So thank you, Linnea, for sharing that link if people are interested. Jennifer with the Lung Cancer Research Foundation, thank you. They have fact sheets and resources on their website. So Jennifer, please share your website so people can grab those. I've looked at them. They are wonderful. You are hosting interactive webinars that have been fantastic and super helpful. So make sure to keep sharing those. Annika with the Milwaukee Tobacco Free Alliance is monitoring smoke, vape, cigar, and the CBD shops, which should be closed according to the Governor Evers Safer at Home order. So I know there was information that came out yesterday about those that maybe increasing their risk because of tobacco use. So thank you, Annika. Jennifer Balistreri is also sharing on behalf of the Wisconsin Breast Cancer Coalition that they are moving their events to virtual settings, so their annual survivorship chair art program, and folks can then participate from across the state in informational meetings will be coming up. And one last one, we have Kim Kinner with the American Cancer Society that was also sharing information on what the American Cancer Society is doing and a great resource that they have on their website about what COVID-19 means to the cancer community. So thank you, Kim, for sharing that. I will keep the chat going with the resources that people are sharing, but I know we also have several questions that had come up during the call. So what do you think, Alex? Should we move on and list some of the questions that had come through?
Yeah, I think it'd be great to move on to our question section. I know you have been tracking the questions that have been coming in throughout the webinar. So I'll hand it back over to you and let you ask some of those questions. And if anybody else has questions they'd like to write in now, feel free. You can direct them to us or our experts, Dr. Noelle LeConte and also Dr. Mark Wagner. Thanks, Beth.
Great, thank you. We did have a number of questions that came in when Dr. Wagner was presenting, so I want to make sure that we get those addressed. So Dr. Wagner, there was a question regarding the numbers that are coming in Wisconsin, and how does that compare to other states or regionally or nationally? So how does Wisconsin sit as our numbers when looking at other areas?
Sure, that's a good question. As Amy had mentioned about the policy section, that we were aggressive, I think, earlier on than a number of states in instituting the safer at home and closing schools and getting some of those some of those separation measures in place. I'm not 100% sure, exactly how we compare directly to some of the other states, but I do feel that we have not seen as big of an uptake as some areas. So I think and again, it's a matter of continuing to do all the right things to make sure that continues.
Great, thank you. Dr. Wagner, there was also a question about the county level data. And is it determined by their residence or the location of their testing? And is there any data that's being lost to individuals that might be treated in Iowa or Minnesota?
Yeah, I know that's a huge issue with cancer reporting, but for these, for the cases that we're seeing on the website, that is information that is coming from place of residence, and the reporting goes directly to the local health department where that individual resides. So we're not losing cases on the border in this particular situation.
Great, thank you. One final question that came in was, why are we seeing more cases and deaths in Milwaukee compared to other parts of the state?
Certainly. Yeah. One thing for sure that we're seeing is that the more population dense areas of the state are hit harder. But yes, even with that, Milwaukee is hit even more severely than we might expect just based on population. And I think that has to do with, as that slide showed, about the inequities in and the impact on this with respect to race, and the fact that Milwaukee County has a larger proportion of African American residents living there. So I think it's both the combination of the population, just there's a bigger population density in Milwaukee, and the fact that we have, unfortunately, those disparities.
Great, thank you. I think I will just kind of open up to the team and see who might feel best to address it. But there was cancer patients are at 3.5 times higher risk of poor outcomes with COVID-19. Does this include survivors?
Beth, this is Noah LaConte. I can answer that. It appears in the data that we have, it does not. It appears to largely include active cancer patients, which in the Chinese literature, which is the bulk of what we have so far, were people that were within 40 days of treatment. And somewhat surprisingly, even immune therapy seemed to worsen their outcomes. There was some hope that maybe it was just traditional chemotherapy that lowered blood counts, but we seem to be seeing the effect across all forms of treatment, including surgery within 40 days. For people that are more remote survivors, it's unclear. We think long-living bone marrow transplant patients may be at higher risk, but we're encouraging people to have conversations with their doctors about their risk and whether it makes sense to try to work from home or get off work if they're considered an essential worker, et cetera. But all of the data seems to be active treatment patients for right now.
Thank you, Dr. LaConte. We have another one that, what can cancer survivors who are essential staff do to protect themselves during the outbreak?
I'll take a stab at this one too. I may need Amy Johnson's help with some legal issues, but we are encouraging patients to get a formal letter about risk from their oncologist. At UW, we're stratifying people into low, medium, and high risk, and then that should facilitate a conversation with their manager and HR about whether they can be shifted to different duties with lower exposure risk, or whether they can work from home potentially, or whether they can take a leave from work to lower their risk. So those would be the things people can do, but we would encourage conversations about implications, for example, access to insurance coverage if you do take a leave from work. Outside of that, just wearing masks, lots of hand washing, limiting exposure to crowds and other people as much as possible. But there are many, many, many cancer patients and people with these high-risk comorbidities who are right at the front line. So I understand the anxiety, and I wish I had a much cleaner solution and answer.
Thank you, Dr. LaConte. We have another one probably very similar, but this one's specific to how patients on radiation treatment are being managed with the precautions and any special instructions for those patients that are undergoing radiation therapy.
I can speak to the UW. So we've been trying to give people shortened radiation courses, for example, using SBRT versus traditional fractionated radiation. We've been spreading out appointments over the day so that we don't have as many people in the waiting room. We physically have separated chairs. And then the radiation technologists are doing their darndest to try to disinfect the machines and the tables between patients, but it's not perfect. We are instructing all of our patients to wear masks, and we're screening every patient upon entry for fever and any symptoms, and we are not allowing people to have family members with them. We're asking rides to wait in the parking lot. So those are the strategies we've used, but radiation most of the time is not something you can just push out 3 to 4 months. It probably needs to be done pretty soon.
Great, thank you. One more question here. Is there a way for individuals who are out of work or have more time on their hands to help cancer patients during COVID-19 pandemic? Any community organizations that have volunteer help options?
So both Madison and Milwaukee have running lists. I can distribute that to Alex to get out to everybody else after. I think people who can should donate blood. They also can help with sewing masks. There are many, many agencies, in particular hospice agencies, that are seeking non-medical grade masks for volunteers. Those would be the things that come top of mind to me right off the top of my head. I'm sure others on the call have ideas too. Of course, social distancing is an act of love for all of our cancer survivors out there, and that should be strongly encouraged as well.
Thank you. If there are additional thoughts on this question, if there are places that you know of, or if you are a community organization or healthcare system that has an opportunity, please feel free to share in the chat. We are gathering all of the information from the chat, and we will be gathering that, posting the resources for not only people on this call, but for everybody interested to find at a later time. Thank you, Regina. Regina Vidavar stated that food banks still need physical volunteers. So that is another opportunity. Any additional questions or comments for the team?
Beth, if I can add one that has come up for me. In this process of doing virtual advanced care planning for cancer patients, we've been struggling with getting people's healthcare power of attorney witnessed. So it has to be witnessed in person by two adults who are not on the healthcare team, are not related to the patient, and are not living with the patient. Is my understanding, and multiple patients and caregivers have reached out that they're struggling to have that requirement met. And so one suggestion that has bubbled up is the use of title agencies, which apparently are open and staffed currently still, and would have people who could witness that. Potentially faith organizations might be another place to access. Normally in the hospital, we can use chaplains and social workers to do that. However, most are working off-site or are otherwise committed in a way that they can't break off to do power of attorney witnessing. But I think this could be also an opportunity for video conferencing, where people can physically see the person signing the document and then can sign. You can drive and get one person to sign and then drive and get the other person to sign. So not immediately in real time, but would meet the requirements.
Thank you, Dr. LeConte. Alex, that is all the questions that were in the chat, so I'm going to turn it back over to you.
Thanks, Beth, and thank you guys all for your great questions. Now I want to share some of the resources that I referred to today and where lots of our information came from. We will be sending out a handout with all of these resources sometime today. We'll also include the resources that were shared in the chat box as well. So next month, we will be holding another networking webinar. This one will be cancer control efforts in our new world. It will focus on how organizations are adjusting and still making an impact, what we can do to make sure people are still getting screened, patients are still going to appointments, and also how cancer healthcare has changed with COVID-19. Registration for this is open now, and it will take place on May 14th from 10 to 11. And then finally, we wanted to end on a more uplifting, positive note with a quote from Morath El-Echkar, who is a practicing family physician and faculty member at the University of Washington. He is also the author of Roads to Meaning and Resilience with Cancer. So his quote is, "Yet people with cancer are perhaps better prepared than many to face an existential threat. We've developed resilience and learned to live in the here and now. As our society faces an illness that is serious and devastating, we, cancer patients, can share a few lessons from dealing with our infirmities. With support and care, you can find the strength to carry on. You keep going and you give it your best shot. And always try to remember, today is a gift." So thank you all again so much for joining. We will be sending out the slides and a link to the recording later today, along with that resource link.